Symptom we thought would go away quickly turns into a lingering complaint. But two Harvard emergency room physicians believe that diagnosis is becoming a lost art, that taking your medical history leads to so-called cookbook medicine, where a list of tests and rule-outs are ordered that may even delay your diagnosis or put the patient through unpleasant tests that could all be avoided. And Dr. Leana Wen is co-author of When Doctors Don't Listen, a new book. If she's familiar to you, that may be because she's a graduate of Washington University School of Medicine. Thanks so much for coming in, Dr. Wen. Why did you write this book?
I wrote this book because when I was a medical student, my mother was diagnosed with breast cancer. And seeing her through her illness and her misdiagnoses and complications with treatments, I saw how disempowered patients can feel with their own health. And so When Doctors Don't Listen is an attempt to show patients how they and their family members can take control of their health to get the best care possible.
Many people have had this experience. I've also had this experience with a family member, so it really strikes a chord. You have 5 tips that patients and their families can do if they feel like they're stuck in this situation. The first one is ask your doctor again, and you say ask nicely.
Ask nicely, always show respect. Don't just go to the doctor and say, well, you're misdiagnosing me, I don't trust you, but rather ask nicely.
And say, I have questions about why we're doing something. Is it okay to question specific things?
Absolutely. You should always ask for your diagnosis. You should always ask about why things are being done.
Okay, that is the second one. Ask why a test is being ordered or a treatment is being ordered. And it sounds sort of counterintuitive because don't we expect doctors will explain this to us?
But doctors often say, you need to get blood work done, you need to have this test done, but they don't say why. So question them and make sure you understand yourself.
Okay, great advice. Enlist a friend or a family member to question for you. Why?
You should always have an advocate with you every single time that you go to the doctor. You may already not be feeling well. Even the flu will knock you over. You just don't feel like being an advocate in that moment. So somebody else needs to be there for you.
I also think your memory isn't quite on. You know, the doctor may throw a lot of information at you, but like you say, if you're not feeling well, you can't remember. Okay, ask another member of the healthcare team, a nurse that you trust, or someone on the doctor's medical team for advice.
Right, and that person can be your advocate as well if they know what your concerns might be.
Okay, is that considered rude to the doctor to kind of go around him and ask somebody else for help?
A good doctor should not perceive that as a threat because we all do work together in a team in a hospital.
Okay, and that comes to number 5. Tip number 5 is get a second opinion, which is one I love, because why wouldn't you want another set of eyes on something as important as your health?
Absolutely, and if something doesn't make sense to you, it's not going to make more sense later. So ask again. You are your best advocate for your health.
All right, Dr. Leana Wen, the book is When Doctors Don't Listen. You're signing this tonight. We're going to have the information on KSDK.com. Great topic and really information we all need to know.
Thank you
so much.